Hi, I'm Tamara Nashman, and I was in a plane crash in 1984 that was very debilitating. It did some serious damage to my neck that left me in chronic pain for many, many years, and thankfully I found a wonderful chiropractor that helped me, got me back on my feet, alleviated some of the pain, and made my situation and my symptoms far, far better. However, I still have problems with my neck and my back at times, and I have bone spurs on my cervical due to the plane crash, that if my neck is manipulated through certain forms of chiropractic, then I will have severe problems for months with pain radiating from my neck into my shoulder and down into my arm and even my hand. And I'll have numbness in the first two fingers, and it's just an ongoing and chronic problem, so I can never be manipulated through the popping of the neck. So I'm excited about this orthospinology that I've been told about and Dr. Brian has talked to me about, so I'm anxious to see what happens when he works on me.
First thing we do is an evaluation. Let's let that relax. And we're just checking out to make sure her nerves are working okay. So we do deep tendon reflexes, muscle testing. I want you to bring your arms up. Hold that for me and push down. She has good strength. Bring your arms here, hold, and push down against me. Flex your wrists up, hold, wrist down, hold. Very good. And from there we're going to move around to the back, and we're going to palpate or touch her neck to see, and her bone in the top of her neck feels like it's over to the right as well.
Yeah,
is that tender right there, Tamara?
Very.
Okay. As we come down to the right shoulder, is this tender?
Yeah,
Through this
a little.
trapezius?
It's still really tight.
How about the left side?
Yeah, that's tender.
And as we come down here, how is that?
Yeah, that's
tender as well?
No, just where you were a little higher, it was tender.
Okay. As we come down to your low back, do you feel any tender
Yeah,
spots here?
definitely.
And how about here?
Yeah.
Okay. We're going to do some orthopedic tests. I want you to look straight ahead. I'm going to compress your head. Does that cause any discomfort? The side bend to the right. Does that cause any discomfort?
No.
Let's go to the left. And does that cause any discomfort?
No.
All right, we're going to twist her around. How about there? Does that hurt a little bit?
It just was...
In the sides, okay. It can be just tenderness, not severe pain. Is that uncomfortable for you? Is that a bad way?
It's not terrible.
It's not bad.
It's a little bit.
How about there? Is that sore?
No, but it feels good.
How about there?
No.
Okay. All right, we're going to get you to lay on your back. As we look at her legs while she's lying on her back, you can see that her left leg is about a ½ inch shorter, or appears to be shorter, than the right. The x-rays that we take differ in that it's a precision aligned x-ray unit with head clamps that are perfectly centered so we can get the center of the patient's skull. Alright, we've just taken x-rays of Tamara Nashman, and what we're looking at is the alignment. And the base of the skull is here, here's the neck from here to here, and what we're looking at is the relationship of this bone in the top to the skull. We should have a line in the center of the skull, one in the center of the neck, and one across this top bone, and they should be 90 degrees to one another. That would mean the neck and the hole in the base of the skull completely line up where the spinal cord comes through. And as I'm standing here, this is the way my neck would look. And Tamara's neck, we'll show the x-rays in a second, looks like this, and this bone at the very top has gone to the right 9 degrees, which is why her head has to constantly use muscles to fight to pull her head weight back over. That's what creates what looks like a short leg, because the muscles down one side of her body are contracting to pull her head weight back over. So how we'll treat this is we'll move this little bone back over to the right, and we'll pull this shoulder down and change the configuration of her neck, which will take pressure off the muscles and take pressure off her spinal cord, let her leg come down, and take pressure off all the soft tissue that's involved up here. Let's take a look at these x-rays real quick and you can see these. I'm just going to put this out. This is what we're looking at right here. This little bitty curve that comes up, and then her head has to correct. This is over to the right like that, which is what we're seeing there. This line represents the center of her skull. This line represents the center of her neck. And this line right here represents the center of the bone at the very top. These should be at 90 degrees, and you can see how this line is shifted up on the right side and the neck has shifted over like that. So her whole body has weight to the right. Once we adjust this little bone, we should be able to reduce these numbers. Usually 50% is where we like to go in the first treatment. This is the Orthospinology machine, and we have perfect angles, perfect settings. It is laser guided, so when we ask you to close your eyes, it's because we don't want that laser light in your eyes. This has a spring load. It can never push more than 1.5 pounds or 2 pounds. So as we push it down, it's a very gentle tap. It's just a perfect angle. It works because the headpiece is very firm and your head can't move around or wiggle like an other adjustment where you push and everything moves and pops.
Yeah.
This isolates you so we can move in relationship to your skull. Okay? You ready?
Great. Yeah, let's do it.
Okay. Let's get you on your side, and we're going to lay you on your left side here. We're going to put your ear right here.
Okay.
And the key here is to relax, because this is not going to hurt you. You're not going to feel much of anything, actually. I want you to scoot down toward the foot just a little bit down.
Okay.
There you go. Now, just relax. I've got a little groove in this headpiece I'm trying to get you fixed. Are your earrings okay? They don't
I don't have any on.
Okay, great. Now, I want you to relax. I'm going to move you around a bit, and I'm going to move your legs where everything is nice and relaxed. Let me have your shoulder. And I'm going to pull. Does that hurt you?
No.
Okay. Is that somewhat comfortable for you?
Yeah, it's fine. Gotta get my hair on my eyes. There we go.
Okay. Alright. Just hold it right there. And we're trying to feel for a little tender spot, and that should be
Yeah, you found it right there. That's
That's
definitely it.
Okay. That's the pressure you're going to feel right there. That's a little tender right there because that bone is sharp, but it's not going to be much more pressure than that.
Okay.
Now we're going to take another instrument and measure around your skull, so we know there's numbers on the table in every way you can measure angles. And we're writing your numbers down so we can reproduce this adjustment if our result is as we want it.
Great.
Alright. Close your eyes for me, please.
Okay.
And we're going to go ahead, we're going to treat you. Now relax your muscles. You're going to feel a little pressure here.
Okay.
And you ready? Here we go. I'm going to do that just a couple of times. You okay with that?
Yeah.
Don't move. Got one more place to go. Now we're going to the second cervical. Her second cervical is to the right 9 degrees, so we're going to push it back just a little bit toward the center. You're going to feel a little pressure here. Try to relax for me. We got 3 of those. 2 and 1 more. That's all there was to it. How'd that feel?
That's amazingly painless.
Okay, let's go ahead and sit up for me now. And let's see how the neck feels. It's much better, actually.
Yeah, it doesn't hurt. I don't feel the tenderness I did before. Before the adjustment, my legs weren't even. Look at them now. That's amazing.
This is where we started. This is the center of her skull. That's the center of her neck. And this little dot here and this little dot here should be lined up straight. Her angle over here, she's 5 degrees to the left and 1 degree to the right up here. The spinous, or the second cervical, is rotated 9 degrees. After that adjustment we just did, or almost perfectly 90 degrees, you can see the difference from here to here. We're now 2 degrees to the right instead of 9, and we're 3 degrees over to the right with the neck instead of 5. The top part is perfect with no rotation.
That's incredible. Really, I mean, that's incredible.